Health Watch. Prediabetes is a condition that impacts millions in the U.S., yet many Americans don't know they have it. According to the CDC, nearly 84 million people have dealings with the illness, but luckily prediabetes is preventable and treatable. So Dr. John Anderson is a physician for HCA Healthcare's TriStar Centennial Medical Center, and he joins us now from Nashville to talk about this. This is something that I've heard, sort of relatives say that they're pre-diabetic and try to determine what that means. Does that mean they are guaranteed to be sort of on the road to diabetes or not? So, doctor, millions of people are dealing with this condition, but they don't know what it is. What exactly is it?
So prediabetes is a state where glucoses and sugars are not normal, but they yet haven't progressed to full type 2 diabetes. And as you said, there's 84 million people with prediabetes, and there's about 30.3 people with diabetes. 90% of the people with diabetes in the United States have type 2, and we're talking about prediabetes in the progression to type 2 diabetes. It really is a window of opportunity where people can identify being pre-diabetic and have a chance to probably either markedly delay or actually prevent the progression to type 2 diabetes.
So are there any symptoms? Because anytime I've ever heard of somebody finding out that they were pre-diabetic, it's because they took a test and they really didn't know before that.
Right. And so one of the things we talk about is if you're at risk, you need to be with your healthcare provider and you need to be getting regular screening. And of course, prediabetes, the main thing that we talk about that was proven in the diabetes prevention program is lifestyle interventions and trying to change some of those habits.
So what are these habits that we're talking about? How can you reverse this disease if you end up getting a test and you find out that you're pre-diabetic?
So if you're identified as having prediabetes, what the diabetes prevention program showed that even just 5 to 7% weight loss markedly delayed the onset to type 2 diabetes by 58%. Now, when we talk about a 5 to 7% weight loss, think about this. If you weigh 200 pounds, that's 10 to 14 pounds. That's very doable. It's not like you have to go out and lose 50 pounds. So this is something that we know our patients can achieve. And there's an exercise component, there's a dietary component. In the study, they had people walking 30 minutes, 5 days a week. Again, a very achievable goal. So I think it's important when patients are identified with prediabetes, they understand there really is something they can do about it.
So who's at most risk here?
So the epidemic in the United States is being fueled by several things. First of all, we're living longer. So as you live longer, you have a risk for developing diabetes. Also, we're a much more diverse nation. So people who are African American, Hispanic, Asian Pacific Islanders, Native Americans are at increased risk. And of course, the obesity epidemic is really fueling a lot of this, especially across the southeastern United States where I live.
And how about medications? Are there any medications that are available for pre-diabetes prevention?
In the study, the DPP, metformin, which is a common first-line drug for type 2 diabetes, was also used. And it had a 31% reduction as opposed to the 58% reduction that was achieved in terms of prevention with lifestyle. Now, there is no FDA-approved product for prediabetes, and I don't anticipate that changing anytime soon. So as of yet, there are a lot of medications that have been studied and have been shown to be beneficial for prediabetes, but are not yet FDA-approved for that treatment disease.
All right, so go to your doctor, get the test done. There are things you can do if the test comes back positive. Change your lifestyle. Some medications available. Don't be afraid, right, doctor?
That's exactly right, and take it seriously.
All right, Dr. Anderson, thank you very much.